I'm Dr. Hart, a GP in Bradford who's helped work on the referral pathway for the Rethinking Pain service. Welcome to this video talking through the resources we have provided to use with your patients with chronic or persistent pain. The hope is that you'll be able to help the patient make an improvement in their pain within primary care, therefore not needing to refer into Rethinking Pain. However, we know that there will be a proportion of patients who need some extra support, and I can show you how to refer those patients into the service. To start a referral, open the patient records and go to the Assist icon in the demographic box. Once you open this, you'll see the Pain Management button on the template. As you can see here, Rethinking Pain is one of the options available within Bradford and Craven to help with pain management. If you want to go down the referral route, please click on this button. Let's start with the Patient Resources button. As you can see, there are quite a few websites with really helpful advice, starting with the Rethinking Pain website itself. On this website, you can find videos for relaxation and movement, people's stories, peer support groups, and a whole section on diet and chronic pain, including ideas for tiny changes and our diet therapy workshop. The videos, numbering over 130, are also available on the YouTube channel, which you can also send to the patient. There is also a video that explains pain in less than 10 minutes, which I encourage my patients and colleagues to watch, as it really helps to flip the idea of how to manage pain from a clinical management to a holistic one. I would recommend familiarising yourself with these resources, as there are lots of examples how pain can be explained to patients, and you may want to borrow some of the phrasing or language yourself. Next, we have resources for clinicians. Again, starting with the Rethinking Pain website, YouTube channel, and the Understanding Pain video. There is a top 10 tips for persistent pain management and medication reduction, hopefully really highlighting the best practice in an easy to manage way. At the bottom, there is the Pain Support Plan and the Pain Flare-Up Plan. The Pain Support Plan is a great tool we have developed using feedback from patients to help patients whenever they interact with any healthcare professional, and to help them to develop a shared management plan driven by the patient's needs and ability to action. I would recommend giving a few blank copies to the patient if they're going to the physio or social prescriber, and they can complete one with each professional. You can then get a copy and scan to the records if the patient is happy with this. Completing one of these with the patient is mandatory before referral to the service. The Pain Flare-Up Plan is another tool developed with patients. This has a lot of ideas for patients to manage their pain flare-ups themselves and try not to rely on medical professionals where possible and where appropriate. I would suggest sending or giving this to patients to work through on their own or with your help, to give them ideas on how to manage their own pain when they are at their worst. On the Healthcare Professional Hub on the Rethinking Pain website, you'll find these and other evidence-based strategies for medication reduction, flare-up management, and community support. You will also find a link to the Opioid Masterclass, our 6-part video series providing expert-led presentations, discussions, and practical insights into opioid prescribing and patient support, developed in collaboration with Health Innovation Yorkshire and Humber. On the service offer page, you can see what the Rethinking Pain service offers patients, including coping strategies, information, signposting, and activities. It also includes what we hope patients will get out of their time within the service. Under the Rethinking Pain referral criteria button, you can see the referral and exclusion criteria here. As you can imagine, there are a lot of people in Bradford and Airedale who have persistent pain. We need to ensure the people who will benefit most from the service and the whole person approach are coming through to the service, and it is not overwhelmed with inappropriate referrals. The final button on this pathway is the Pain Support Plan, Tools and Referral. Please ensure your patient meets all the referral criteria before consideration of referral to Thinking Pain. If we can't see that a patient has met these criteria, we will be in contact asking you to follow this advice and then let us know when you have completed this work. Hopefully, you won't then need to refer into the service at all, and the patient will have improved their pain with your support. If not, the service is happy to accept your referral. If the patient still needs referral, please press the button. Make sure you document all the great work you and your patient has done already, including completing and saving the Pain Support Plan to the patient records. Please remember that this is the newly required document, and without it being completed, the referral will be rejected. The referral is read by health coaches who are not clinical, so please consider this in your use of language and medical terminology when referring. At point of discharge, a Rethinking Pain Care Plan Complete document will be uploaded that charts the patient progress, what workshops they have attended, and key areas of progress made with their health coach. This is the equivalent of a discharge letter from any other secondary care clinic. The referral pathway remains relatively unchanged. We have now included more resources and information for patients and for healthcare professionals, and the Pain Support Plan to complete with the patient and upload. This change has been made in line with consultations with patients about their own experiences and is in line with NHS guidance on personalised care and shared decision-making from 2022. Hopefully this has been very useful and you'll feel more confident in your ability to support patients with persistent pain and will be able to refer when needed.